Brain tumor surgery, also known as craniotomy or neurosurgery, is a complex medical procedure performed to remove or treat abnormal growths of tissue within the brain. The specific techniques and procedures used can vary depending on the type, location, size, and characteristics of the tumor. Here's a detailed overview of how brain tumor surgery is typically performed. Preoperative evaluation, patient assessment. The process begins with a thorough evaluation of the patient's medical history, symptoms, and physical condition. Neuroimaging studies like CT scans or MRI scans help identify the tumor's location and size. Anesthesia. Before surgery, the patient is placed under general anesthesia to ensure they are unconscious and pain-free during the procedure. Surgical team. A skilled neurosurgeon leads the surgical team, which typically includes an anesthesiologist, neurosurgical nurses, and, in some cases, a neurophysiologist to monitor brain activity during the surgery. Positioning. The patient is placed in a specific position on the operating table, which may be flat or tilted, depending on the tumor's location. Scalp incision. The surgeon makes an incision in the scalp, typically in a location that allows for the best access to the tumor while minimizing damage to healthy brain tissue. The type and size of the incision depend on the tumor's location. Skull opening. After the scalp incision, a piece of the skull is removed, creating a bone flap. This bone flap is temporarily removed and stored, allowing access to the brain. Brain exposure. The dura mater, a protective membrane covering the brain, is carefully opened, revealing the brain's surface. Intraoperative imaging. In some cases, intraoperative MRI or CT scans may be used to help guide the surgeon, ensuring they remove as much of the tumor as possible while avoiding damage to vital brain structures. Tumor resection. The neurosurgeon carefully dissects and removes the tumor piece by piece, taking care not to harm critical brain regions responsible for functions like speech, motor control, and sensory perception. Hemostasis. Hemostasis, or controlling bleeding, is crucial during the surgery. Surgeons may use various techniques, such as electrocautery, hemostatic agents, or sutures, to achieve this. Biopsy, if necessary. In some cases, a biopsy may be taken to determine the tumor's type and grade. This helps guide post-operative treatment decisions. Tumor removal confirmation. The surgeon may use intraoperative MRI or imaging to verify that the tumor has been adequately removed. In cases where total removal is not possible, a debulking procedure is performed to reduce the tumor's size and alleviate symptoms. Closing the surgical site. After ensuring the tumor is removed, the surgeon carefully closes the dura mater, replaces the bone flap, and sutures the scalp incision. The bone flap may be secured with plates, screws, or other fixation methods. Post-operative monitoring. Following surgery, the patient is closely monitored in the recovery room and then in a neurosurgical or intensive care unit. Regular neurological assessments are conducted to check for any deficits or complications. Recovery. Recovery time varies depending on the surgery's complexity and the patient's overall health. Rehabilitation and post-operative care may be necessary to aid in recovery. It's important to note that not all brain tumors can be surgically removed, and the choice of treatment depends on various factors, including the tumor's type, size, location, and the patient's overall health. Some tumors may require a combination of surgery, radiation therapy, chemotherapy, or other treatments. The surgical approach and technique will be tailored to the individual patient's needs and the specifics of their condition.